Boundaries, ethics, laws, and regulations, massage, MBLEX 40 questions. Question 1. What is the client can stop treatment at any time, a client to refuse any part of treatment even if permission has been given previously? A. Countertransference. B. Code of ethics. C. Therapist right of refusal. D. Client right of refusal. Question 1 Answer, D. Client right of refusal. Question 2. What is watching a client undress or holding a client in a sexual way? A. Sexual misconduct. B. Assessment. C. Informed consent. D. Gender issues. Question 2 Answer, A. Sexual misconduct. Question 3. Would you do if a client needs a treatment outside the scope of practice? A. Therapist right of refusal. B. Refer the client to another professional. C. Client right of refusal. D. Rights as professional. Question 3 Answer, B. Refer the client to another professional. Question 4. What is refusing to work on a client due to race, religion, size, or sexual orientation? A. Scope of practice. B. Bigotry or discrimination. C. Projection. D. Professionalism. Question 4 Answer, B. Bigotry or discrimination. Question 5. What is refusing to adapt office for clients with physical challenges? A. Confidentiality. B. Lack of accessibility. C. Accountability. D. Professionalism. Question 5 Answer, B. Lack of accessibility. Question 6. When a client discusses personal matters with the therapist you should: A. Therapist should be calm and accepting. B. Rights as professional. C. Therapist right of refusal. D. Therapist should listen and be compassionate. Question 6 Answer, D. Therapist should listen and be compassionate. Question 7. The scope of practice of a massage therapist and observing that the muscles are tight, and gathering information to make informed decisions about the treatment. A. Assessment. B. Projection. C. CO worker. D. Ethics. Question 7 Answer, A. Assessment. Question 8. What has client relationships, professionalism, scope of practice, appropriate techniques, images, advertising claims? A. Informed consent violations. B. Refer the client to another professional. C. Associated bodywork and massage professionals. D. Rights as professional. Question 8 Answer, C. Associated bodywork and massage professionals. Question 9. What is name dropping clients, telling a spouse details about the partner session, discussing a massage with a client and a public place such as a grocery store? A. Lack of accessibility. B. Violations of confidentiality. C. Confidentiality. D. Informed consent. Question 9 Answer, B. Violations of confidentiality. Question 10. What is the standard of conduct, goals, quality of workers in the same field? A. Professionalism. B. Projection. C. Assessment. D. Confidentiality. Question 10 Answer, A. Professionalism. Question 11. What is Health Insurance Portability and Accessibility Act, enacted in 1996, involves security and privacy of healthcare issues, specific guidelines that relate to privacy? A. Ethics. B. HIPAA. C. Disclosure. D. Rapport. Question 11 Answer, B. HIPAA. Question 12. What is it when a person has uncomfortable feelings and projects them onto others? A. Projection. B. Professionalism. C. Ethics. D. Rapport. Question 12. Answer: A. Projection. Question 13. What is guiding principles for distinguishing between right and wrong? A. Code of ethics. B. Ethics. C. HIPAA. D. Rapport. Question 13. Answer: B. Ethics. Question 14. What is an agreement to participate in activity after the purpose has been explained, a protection process for the consumer? A. Assessment. B. Projection. C. Informed consent. D. Informed consent violations. Question 14. Answer: C. Informed consent. Question 15. The influence of age on touch is most likely to be a consideration regarding what? A. Disclosure. B. Gender issues. C. Ethics. D. Geriatric massage. Question 15. Answer: D. Geriatric massage. Question 16. If the therapist for the first time suddenly gives a regular client a big hug after the session, what did the therapist did? A. The therapist has crossed the client's boundary. B. Refer the client to another professional. C. Therapist should be calm and accepting. D. Therapist right of refusal. Question 16. Answer: A. The therapist has crossed the client's boundary. Question 17. What is any action of verbalization of inappropriate sexual nature towards the client? A. Informed consent. B. Gender issues. C. Sexual misconduct. D. Disclosure. Question 17. Answer: C. Sexual misconduct. Question 18. If a client does not want to fill out a medical history form, the client must feel that the disclosure would cross a boundary and the therapist should do what? A. Therapy should offer alternatives such as taking the information verbally or filling out a shorter form. B. The client should be reported to child welfare authorities. C. Therapist should listen and be compassionate. D. The therapist should not give the massage and ask for a parental release to be signed in your presence. Question 18. Answer: A. Therapy should offer alternatives such as taking the information verbally or filling out a shorter form. Question 19. If the therapist is aware of someone practicing massage therapy without a license, the therapist should do what? A. Geriatric massage. B. Refer the client to another professional. C. Therapist right of refusal. D. Send a complaint to the state's massage board. Question 19. Answer: D. Send a complaint to the state's massage board. Question 20. What is service limits boundaries as determined by legal, educational, competency, and accountability factors, knowing base and practice parameters of profession? A. Scope of practice. B. Code of ethics. C. Projection. D. CO worker. Question 20. Answer: A. Scope of practice. Question 21. What is in the professional therapeutic relationship? A. Refer the client to another professional. B. Confidentiality, scope of practice, client-centered actions and words, consistency, informed consent and right of refusal, contract, rights of professionals. C. Therapist should listen and be compassionate. D. The therapist has crossed the client's boundary. Question 21. Answer: B. Confidentiality, scope of practice, client-centered actions and words, consistency, informed consent and right of refusal, contract, rights of professionals. Question 22. If a client reveals that they are guilty of child abuse, the law may require that the client should be what? A. Client right of refusal. B. Therapist should be comment accepting. C. The client should be reported to child welfare authorities. D. Therapist should listen and be compassionate. Question 22. Answer: C. The client should be reported to child welfare authorities. Question 23. What is the feelings of a therapist towards the clients? Example: when a therapist gets angry because the client is talking too much or complaining about personal problems. A. Co-worker. B. Gender issues. C. Transference. D. Countertransference. Question 23. Answer: D. Countertransference. Question 24. If a client reenact abuse while on the massage table by crying and shaking, what should the therapist do? A. Bigotry or discrimination. B. Therapist should listen and be compassionate. C. Therapist should be comment accepting. D. Therapist right of refusal. Question 24. Answer: C. Therapist should be comment accepting. Question 25. What is it when a client has feelings towards the therapist? For example, the client gives the therapist a gift that show affection. A. Assessment. B. Transference. C. Rapport. D. Countertransference. Question 25. Answer: B. Transference. Question 26. What is it when a male client requesting a female body worker? A. Gender issues. B. Ethics. C. Disclosure. D. Assessment. Question 26. Answer: A. Gender issues. Question 27. What is a sharing of personal information with permission? A. Ethics. B. Disclosure. C. Rapport. D. Assessment. Question 27. Answer: B. Disclosure. Question 28. What is socializing, group affiliation, friendship, dating, sexual activity, family, bartering, client, practitioner reversal, employment, interactions between students and school personnel? A. Professionalism. B. Ethics. C. Dual relationships. D. Projection. Question 28. Answer: C. Dual relationships. Question 29. What is out of the professional therapeutic relationship? A. The client should be reported to child welfare authorities. B. Remain professional and explain the services. C. Medical advice, social needs, personal needs, spiritual device, psychological counseling, other business deals. D. Refer the client to another professional. Question 29. Answer: C. Medical advice, social needs, personal needs, spiritual device, psychological counseling, other business deals. Question 30. What is implying that attending a workshop is the same as an advanced degree? A. Violations of confidentiality. B. Misrepresentation of educational status. C. Informed consent violations. D. Therapist right of refusal. Question 30. Answer: B. Misrepresentation of educational status. Question 31. What is it when a therapist can refuse to work on a client and a certain situation that makes the therapist uncomfortable? A. Therapist right of refusal. B. Transference. C. Client right of refusal. D. Geriatric massage. Question 31. Answer: A. Therapist right of refusal. Question 32. If a caller asked if the massage includes sex or a client asked to be touched in a sexual manner or for a happy ending, you should: A. Remain professional and explain the services. B. Informed consent violations. C. Professionalism. D. Misrepresentation of educational status. Question 32. Answer: A. Remain professional and explain the services. Question 33. What is professionals being clear about what is expected for clients? A. Rights as professional. B. Projection. C. Assessment. D. Professionalism. Question 33. Answer: A. Rights as professional. Question 34. Who would you befriend at the workstation without power differential? A. Projection. B. Assessment. C. CO worker. D. Rapport. Question 34. Answer: C. CO worker. Question 35. If a minor asks therapist to make an exception and give a massage without permission from a parent or legal guardian, the therapist said what? A. Therapist should be calm and accepting. B. Therapist should listen and be compassionate. C. The therapist has crossed the client's boundary. D. The therapist should not give the massage and ask for a parental release to be signed in your presence. Question 35. Answer: D. The therapist should not give the massage and ask for a parental release to be signed in your presence. Question 36. What is the development of relationship based on mutual trust and harmony? A. HIPAA. B. Ethics. C. Rapport. D. CO worker. Question 36. Answer: C. Rapport. Question 37. What is the quality of accepting the consequences of one's actions? A. Ethics. B. Confidentiality. C. Accountability. D. Rapport. Question 37. Answer: C. Accountability. Question 38. What is working on a minor without parent-told knowledge, treating the injury without permission? A. Code of ethics. B. Informed consent. C. Confidentiality. D. Informed consent violations. Question 38. Answer: D. Informed consent violations. Question 39. What is keeping information private? Respect for client's right to privacy. A. Gender issues. B. Professionalism. C. Accountability. D. Confidentiality. Question 39. Answer: D. Confidentiality. Question 40. What is commonly accepted guidelines or principles of combat that govern professional conduct? A. Ethics. B. CO worker. C. Code of ethics. D. Scope of practice. Question 40. Answer: C. Code of ethics.